Okay. Which of the following genetic abnormalities is most commonly associated with this patient's condition? Okay. A 5-year-old girl is being evaluated for developmental delays. Her parents report that she has difficulty with expressive language and understanding spoken language. She also has trouble with social interactions, avoids eye contact, and demonstrates repetitive behavior such as hand flapping. She has been receiving speech therapy for the past year and has been slow, but progress has been slow. Which of the following genetic abnormalities most commonly associated with this patient's condition? Man, I don't know. I think a 5-year-old girl with hand repetitive behaviors. My mind went to Rett syndrome, that they always usually talk about like she was doing fine and then they return back to like something. So I'm not thinking that.
Okay. Give me
Um,
another diagnosis then.
so social interaction behavior, maybe like Williams syndrome, or like that's like I think William or what the other one. There's one with like not Williams, but there's another one that has like weird interactions with I don't know. I don't think it's Down syndrome because I've never heard of, and so at this point, I really don't know the diagnosis. Would it just be okay to like start going to the answers?
Yep. Sometimes you get stuck and then kind of figure out another way then.
I don't think it's trisomy 21, Fragile X. When I think of 5Q, I think of Williams syndrome, but I think Williams syndrome is the people who are like social, like they have awkward smiling or like they laugh, something like that. And so what I would go with is I remember seven Q being something, but I don't know what. And so I would honestly pick D in this case, but I don't know.
Okay, so let's take a look here. So Fragile X, developmental delays, avoidance, repetitive flapping, or consistent with, I thought it was autism, right? Fragile X syndrome was
Mm.
single say cause of caused by mutation of on chromosome X. I thought it was autism, which is actually E is probably a better answer than that.
Is there ASD in the question?
Oh, actually, this is kind of interesting. Actually, I didn't know this. This might be correct. So look up Fragile X syndrome and seeing what is the incidence of autism with Fragile X. The patient's presentation is consistent with autism, which that's what I thought the diagnosis was. And then Fragile X syndrome is the most common known single gene cause of autism spectrum disorder. Is that correct?
The prevalence of autism and Fragile X syndrome has been estimated at 50%.
Oh, okay. So it says, okay. If you read the question,
Oh,
actually,
commonly associated with the patient's
commonly
condition.
associated, not the cause, because like we don't have a
Wow.
specific cause for autism, right? But they're saying, which genetic abnormality has the highest incidence of autism, and it's going to be Fragile X. So that's definitely the right answer. It's just reading the question carefully here.
Yeah, and I did not. I was thinking like, what is he basically having? Is what I was kind of
Yeah.
reading it. I was like, I don't
So if you
know.
if you if you read through it, it definitely looks like autism, right? Having difficulty with expressive language, avoiding eye contact, repetitive motions, right? And these kiddos are usually delayed in speech, right? And remember,
Mm.
like Rett syndrome, you might get caught off by the flapping of the hands, right? But any kind of repetitive motion autism can have. But and remember, Rett syndrome is the you have to revert backwards, right? So that can't be good
Yeah,
because she's
yeah.
still progressing just very slowly. So autism's your diagnosis, and then they're saying which one of these genetic issues is associated with autism, and the answer is going to be Fragile X syndrome. But if they ask you something different, like which one of these, how do I say this? Let's just say like what is the cause of autism or something like that, and they give you all these genetic changes, the best answer would be no genetic abnormality, right? Because autism we haven't really located to one specific thing, so
Okay, cool.
multifactorial is what they call it.